Fucking hate it. I think it's a flawed, incomplete model that does not work for most people. Having said that, am I against psych meds? I wouldn't say I'm necessarily against them. I think that treating acute psychosis with antipsychotics makes a lot of sense, because sometimes when you have your Icarus moment and you fly a little too close to the sun, you get burned, and it's nice to have tranquilizers there, or antipsychotics as the pharmacists refer to them, so you don't hurt yourself or others. However, for long-term treatment of mental disorders such as schizophrenia, bipolar, or personality disorders like dissociative identity disorder or borderline personality disorder, I don't think it's an effective model of treatment. There are much more effective models of treatment. The only problem with those is that they take time and patience and attention. How do you cure schizophrenia, Rochelle, you might ask? I have a very simple answer, and it's love. You can literally just love away a mental illness, kind of. It's a combination of tough love, patience, compassion, understanding, and caring, and it's really not that difficult. Basically, there was a house, you can look it up, I forget, I think it was called Soteria Project or whatever, something like that, back in the day, and they took a bunch of men who the psychopharmaceutical model for treating schizophrenia had failed, and they put them in this house and they let them go through their schizophrenic episode, and essentially how you treat or how you measure the success rate of psychopharmaceuticals is essentially you do a 6-month follow-up and you judge their psychosocial functioning. So I think with antipsychotics they had a success rate about 30%. 30% of people with schizophrenia having an acute episode treated with antipsychotics as a chronic treatment had about 30% of those people maintained a psychosocial functioning that was at the level that they had previously pre-psychosis, right? With Soteria Project, they found that over 75% of the participants, without medication and just time, ended up achieving the same level of psychosocial functioning post-psychosis. So what does that tell you? It tells you that treating people with psychotic disorders with antipsychotics is an ineffective model. What should we do then, Rochelle? I don't fucking know, man. I'm not a doctor. I'm not your doctor. But what I would suggest is maybe read about it. Read Kelly Brogan, A Mind of Your Own. Read Robert Whitaker, right? The Anatomy of an Epidemic. It talks all of this information is out there, and I've read all of it because I was unsatisfied. I essentially got labeled with a disorder that essentially meant that I was fucked, and I did not want to accept that, right? I did not want to have to live the rest of my life with this label, so I did research on the internet and in books, and I discovered that there are other ways of treating mental disorders that are more effective than the psychopharmaceutical model. You just gotta look them up, do your own research, and find something that works for you. I mean, am I against meds? No, you can do these therapies in conjunction with meds, right? Meds aren't the solution. If there was a pill out there that made my dissociative thoughts go away with minimal side effects and somehow managed to make me no longer socially anxious, of course I would take it, and I would promote the shit out of this pill. But unfortunately that doesn't exist. That's not real. Ideally that would be great, and I would be like, fuck yeah, everyone should take this pill, but it's not. It's a dream. It's some goal that somebody made up because it sounds great. It sounds like a good solution. Yeah, you're fucked, you're sick in the head. Take this pill and it'll make everything better. The chemical imbalance theory or whatever, which is not even real. I don't know why we're still focusing on the chemical imbalance theory. It's been disproven. People with depression pretty much have the same level of chemicals in their brain, sometimes more, sometimes less. That's not why you're depressed. You're depressed probably because of shit that happened in your childhood that you don't have any control over, or maybe you're depressed because you're not processing your trauma properly, or maybe you're depressed because you're not taking care of your body. Like, there's so many explanations for depression and psychosis, and most of them come from anxiety and PTSD and not processing your pain and your trauma. So the solution really is therapy. Meds, sure, meds are great, they can bring you down, but that's not enough. Meds are not enough. And sometimes, I would say most of the time, they're not even necessary. And especially not for a long-term solution. I would say for acute episodes of psychosis, yeah, antipsychotics, they're great. Give me some olanzapine, bring me back down to reality. But for chronic treatment of disorders such as bipolar or schizophrenia, you do not need long-term antipsychotic use. What does that give you? That gives you diabetes. That makes you fat, sick, and depressed. If they do anything at all, which usually they don't. So what's the solution? Therapy, diet and exercise, all of the neurotypical bullshit that everybody spouts. I mean, have you actually tried it? I don't know. You say it sounds like neurotypical nonsense, but have you tried being neurotypical? Have you tried living a balanced life? You know, have you tried taking care of yourself? I think that as a treatment option, antipsychotics and antidepressants should be what you reach for last, right? After you've done everything else in your power, after you've made sure that you've gotten adequate sleep, exercise, after you've written an angry letter, journaled it out, maybe made some art, or wrote a song, went for a walk in the park, talked to an old friend that you haven't seen in a while, got a massage, maybe did some acupuncture, did some gentle stretching in the park, pet a dog. After you've done all that and you're still like, I want to kill myself, yeah, then maybe go get some antidepressants. Maybe those are for you. I don't know. But for me personally, I was dissatisfied. And I'm on meds right now, and guess what? They really don't do fuck all, because I'm medicated up to my eyeballs, and I'm still insane. Maybe I look more tranquil because I've been tranquilized by antipsychotics and valproic acid, but still on the inside, in my brain, I'm still disassociating, I'm still hallucinating visually, and I'm still fucked in the head, because all of those things that made me go psychotic in the first place are still there, right? All of my pain and all of my trauma, it still needs to be processed, and I still need to integrate a bunch of psychedelic experiences that I probably did not understand properly, and a bunch of other shit, right? I still need to do the work, and I think most people still need to do the work, right? Healing isn't easy, and it doesn't always feel good. In fact, most of the time it hurts a lot. And meds can help you heal, but they're not a solution. And that, I guess, is how I feel about meds. They're part of the solution, but I mean, they're not the only solution. And people are focused on finding this med cocktail or finding the right med. And they think that that's going to solve their problems, and that's going to, you know, it's going to solve this imbalance in brain chemistry that doesn't really exist. But it's not. Because I think you just need to realize that, like, you are a complete person and you are fine as you are on your own without meds, and that maybe being broken isn't necessarily a bad thing, and that we're all flawed and we're all broken, and like meds can help, but like so can everything else. There are so many things you can do to make yourself feel good, right? And to cope with the shittiness of being alive and your living disorder. And the answer doesn't come in a bottle. I mean, it never has. Substances are not the answer. They never really have been. And the only thing that can truly heal you is yourself, and you need to want to be healed, and you need to want to be complete, right? And maybe you're never gonna be complete. I don't think many people ever really attain that unless you're like an enlightened master or like the Buddha or something. But that's kind of what life is. Life is just always about every day working on yourself and moving forward. And whether or not meds are a part of your mental health journey or your physical health journey, that's really inconsequential, because you should be focusing on everything else. Everything else is so much more important than what substances you consume, right? Substances, whatever, they're great, they're fun, but realistically, you gotta put the work in, right? They can help, but at the end of the day, you have to stand up for yourself and get your own needs met. And if you're not doing those things, if you're not doing the work, if you're not doing your dialectical behavioral therapy or searching for a therapist, first of all, everyone should have a therapist. And if you're not doing that or finding those things, then meds aren't going to really help you at all, right? I kind of look at meds like a Band-Aid, right? And it's good to kind of stop the bleeding and stop everything from getting more broken than it already is, but it's not going to help you heal. It's just going to stop you from breaking anymore, maybe, if they do anything, right? I don't know. That's just me. Those are just my opinions. I don't know if this is gonna reach out to anybody else or make any sense to anyone, even myself, after I watch it, but I think that was a good rant. I don't know. Love yourself, man. Love yourself enough. Love yourself like you would love a little tiny baby. And treat yourself like a fetus. And think about all of the things that a little fetus would need to be the best fetus that it could be. And that's how you should live your life. And sometimes, I guess, fetuses need antidepressants. Or, no, they don't. I don't know, man. I don't know anything. I'm just a 22-year-old girl who is dissatisfied with most things in life, and I want to make the world a better place, but I don't know how, so I'm talking to my phone and maybe some people on the internet, and that's how I feel. Read lots of books, educate yourself, and never be satisfied. Keep looking for the best thing out there, because you deserve the best. You deserve the best psychiatrist, you deserve the best physiotherapist, you deserve the best diet, and you deserve the best clothes ever, because clothes are great and I love wearing nice clothes. So don't be satisfied with an answer that, I don't know, makes you feel like shit, because maybe labels are stupid. Maybe labels like depression and schizophrenia and bipolar, maybe they're all stupid and meaningless, and maybe we're all just broken differently, and maybe maybe the solution is being nicer to each other and being nicer to ourselves and practicing self-care. Maybe, but who knows? I'm insane. So with that, I'm signing out. Peace out, A-Town. Love yourselves. Love everybody else. I love you. This was Moon Rocks. Bye.